Hello, dearest friends, and welcome back to our podcast show, Your Fertility Counselor. I have the honor to have Dr. Chua here with me today. Dr. Chua is a fertility specialist working at Alpha IVF Center in Singapore. He has more than 20 years of experience working in this field and has delivered more than 1,000 babies since starting to work. I'm so excited to have him here today because Dr. Chua is not only an expert as a doctor for his patients in fertility, but also he conceived his own three children through IVF. And he will have a personal experience and touch to it when it comes to IVF because he knows exactly what couples are going through with the ups and downs of IVF and what the trigger points can be sometimes in a couple. So I'm really curious to know from him how he dealt with his own fertility journey and how he has converted that into compassion and empathy for working and supporting with his own patients. So get a good cup of tea, some water, and relax and sit back and enjoy. Let's get started. Hello, Dr. Chua. I'm so excited to have you on our podcast show today. How are you?
Hi, hi Tanya.
So, I know that you work for Alpha IVF Center as a consultant, obstetrician, gynecologist, but also as a fertility specialist. And before we dive into all sorts of fertility today, can I ask you what's your morning ritual to get started into your day?
Hi Tanya. Thank you very much. Very happy to be here today talking with you. I
Yes.
understand you're all the way in Bali, which is like one of the nicest places you can be in the world.
Thank you.
Yeah, so
Yes.
every day I will just set my alarm at 6:30 to try to wake up, but usually I will snooze one or two times before I really wake up. And then I
Okay.
will just have my standard breakfast of oats and coffee. It's my
Wow.
attempt to be at least get one healthy meal a day in. And then
Yeah,
I
I just
will
want to say that's very healthy.
yeah, and then I will just dress up, wash up and dress up. My wardrobe is just my cupboard is full of the same type of clothes, shirt, usually blue and black pants. So I don't have to think too much about my outfit.
Okay, yeah,
Yeah.
keep it simple. That's a
Yeah.
really good one.
Then I will have to get my kids in the car, sometimes even drag them, and then I'll drop them off at the preschool nearby, and then I'll be on my way to work. So that's
Oh,
what I usually do. Yeah. Mhm.
amazing. Okay, so what can I ask you? What do you listen in the car? Are you having like conversations with the kids about the school day that comes ahead, or is it music, or what do you listen?
Oh, I usually try to speak to my kids in Mandarin
Oh,
because it's really hard to teach them Mandarin
mm,
in this day and age. It's a really big turnaround because when I was a kid, my dad sent me for English tuition. Because he was worried I couldn't speak English. But nowadays people are worried that kids can't speak Mandarin because we don't speak it at home. So
yes.
in the short time in the car, I'll try and speak to them in Mandarin.
Oh,
But yeah,
fantastic. Wow, that's so great. Yes, and Mandarin is such an important language if you see
yeah,
like how the world is moving, right?
yeah. And I
Yeah,
will, and I,
so
nowadays I just like to listen to interviews with like political figures, like
yeah.
last time previously Lee Kuan Yew or any of our leaders at the moment, if either in Singapore or elsewhere. Yeah.
Okay. That sounds like a smooth start into your day.
Yeah, it's quite interesting sometimes to see what they have to say. Yeah.
Yes, I'm sure it does.
Yeah.
Yes. So back then, if you move back a little bit the time into
Mm.
your studies and when you had to choose between the different universities and what to study. What made you actually move into the area that you are in today?
Oh, yeah. So there were many specialties in the medicine,
Hmm.
but I did ONG, OBGYN, because it's one of the happiest specialties you can be in.
Ah,
Yeah, so every time you deliver a baby, you're actually bringing happiness and joy to the couple and the
mhm.
family. Yeah,
Yes.
and by the way, I also love kids. I have three of them myself, and I find
Yeah.
them very cute. Right, so
Yes.
that's one of the yeah, that's one of the
How
ones
old?
that I wanted to be in. Yeah.
Yes. And how old are your kids, by the way?
Oh, they are the oldest is about 4.5.
Mm.
The second is 2.5, and the last one is a newborn, just
Oh my goodness. Wow.
2 year
Absolute
apart.
spectacular. Yes.
Yeah. So yeah, so it was quite a long journey to in Singapore to become a specialist is at least 12
Mm.
years, right?
Wow.
Includes studying and working.
Yes.
It's quite a long journey. It's not only just studying and passing exams, it's also work, night shifts, and training.
Mm.
And and all that is actually required to get all the experience that you need to be a
Mhm.
safe and effective doctor.
Yeah.
So even though it was tough, but I look back at it and I think I'm very happy that I went through it.
Yeah.
Yeah.
Yeah. Yeah. Amazing. And what made you then choose to go into specifically women's health and then fertility?
Oh, it's more of a fertility. I've always wanted to do fertility.
Mm.
It's like it's such a mysterious thing, right? It's like a mysterious puzzle. So why do some people find it so easy to get pregnant
Mm.
and some people struggle with fertility?
Mm.
And until now, I we don't even have the full answer until now,
Mm.
right? So, but I find it very meaningful personally because as human beings, it's our instinct to reproduce,
Yeah.
right? And if you cannot reproduce, then you will find that it is actually it really affects you, your mental, your emotional well-being very much. So to be able to help couples to overcome this problem, I think that it is I personally find it very meaningful.
Yeah. Yeah. Absolutely. And it's so great to hear that you actually seem to be really caring about the holistic approach into the fertility space, and not just the medical side of it, but also on the emotional and mental side of it.
Yeah, so initially it was all about the medical and you train how to get people pregnant. But after a while, you speak to many couples, they realize that there's a lot of stress and worry underneath all that. It's not just as simple as the medical treatment for them, right?
Yeah, yeah. And that's actually what we see very often as well under the umbrella of fertility. There is so many aspects, isn't it? There is one side is the physical well-being, but then also you can see how they really mentally and emotionally struggle with stress, anxiety, sometimes even depression.
Yeah, definitely. And they don't even and they may not even show you that during the short 5 or 10 minute consultation. It's all like beneath the surface. And
Mm,
but you can be very sure they are usually very worried and they're anxious, and it shows in their interaction with each other as well as the questions that they ask you and everything. Yeah.
yeah, yeah. In the practice that you are seeing your patients, like what are some of the really major fertility concerns that come across that you come across?
Uh, I think by far in Singapore, by far it is the main problem is uh older mothers, advanced maternal age,
Mm.
and low egg count.
Oh,
And
wow.
it affects Singapore, but also in many developed countries in the world.
Hmm.
And this is this phenomenon of having later marriage and having children later. And just by doing that, the egg count and the egg quality would have dropped, and
Hmm.
the natural fertility would have dropped. Even though the woman can be totally healthy, eat all the right foods, do other exercise and keep their body clean, for example, their natural fertility will still drop regardless. In fact,
Hmm.
this is the only time in history where more children are born to women in their 30s
Oh,
than
wow.
women in their 20s.
Hmm.
And that affects many of the countries in the world. So I think for Singapore, we are also seeing that now.
Yeah, yeah. And because Singapore actually has started to allow elective egg freezing, is this something that you do as well, Dr. Chua?
Yeah, so actually elective egg freezing is the process is almost identical to the first part of IVF, the whole process, okay? Except that you interrupt it halfway through. Instead of fertilizing with the sperm, you freeze the egg for
Mm,
future use. And I think uh this technology has been there since the 2012, around 2012, when it was fully established as a very effective type of treatment. And I think it is, and our government just allowed it the past 2 or 3 years. And I see more and more women taking it up. And I think it's very, very important to do
mm.
so. Okay, if I were a woman, I would definitely want to have that choice to
Yeah.
be able to freeze my eggs. Yeah.
Yes, yes, yes.
Yeah.
So just to confirm again, so when you say that you're a fertility specialist, you continue to help women who want to actually try naturally, but then you could also support them if they want to do an IUI, an IVF, also donor counseling, donor program, would that be part of it as well?
Yes, so being a fertility specialist, I do all the treatment that you have said so far,
Mm-hmm.
including male fertility. I specialize in male fertility, as
Mm-hmm.
well as any surgery that they need require, maybe for fibroid, cyst, fallopian tube, etc. So
Yeah.
we do donor, and it is getting um but it's more reserved for patients with really cannot produce their own eggs, healthy eggs or sperm.
Mm,
Because naturally most people want their own DNA and their own offspring. Yeah.
mm,
But in Singapore, the donor program is a bit more restricted because we cannot allow any change, any monetary reward, etc. So most people find their own relative, their younger sister, for example, or their younger friend who is willing to donate their sperm or eggs.
yes. Yeah. Okay. Okay. And when do you find it important to have a more deeper conversation with those patients that want to try naturally, but then ultimately you can see that from the age or from the count of eggs, what you mentioned at the beginning, it might be challenging to conceive naturally, and they may need to start considering IVF as well. How do you, because I think sometimes this discussion or this conversation could be quite tricky as a doctor as well to open up on this topic. How do you do it?
Yeah, I totally agree. But I think as over the years, but you can really see a shift in people's thinking.
Mm,
Where previously IVF was a bit more taboo and people don't really talk much about it. And if they do go for it, they are actually very secretive and they don't tell anyone, including their own family members. But nowadays, it's more and more out in the open, and most people are more willing to share.
mm,
And it's not so much of a taboo topic for it because there are simply so many people who need IVF and go for IVF. So it is easier nowadays. Really depends on their underlying fertility problems. Some fertility problems will really need IVF, and you can't really get pregnant naturally. For example, if the tubes are blocked
mm.
or the sperm count is very, very low, then these will need IVF, and I will usually tell them right from the start.
Yeah, yeah, absolutely. I think you shared in our pre-conversation as well that you conceived your own three children through IVF.
Oh yes.
And you are actually quite open to share your own story. Would you
Yeah.
mind sharing a bit of your story now for our listeners so that they get like to hear about like how such a story can evolve into such beautiful three children?
So it's quite an interesting story because I being in the field, my own wife is also a doctor. She's also a gynecologist. So she also understands the rapid decline of fertility, female fertility in particular. So being in the field, and we got married a bit late. She was about 36. And we tried for a few more than half a year, right? But it just wasn't working. And she was actually more, we were quite worried lah, because we both know we wanted a bigger family.
Mm.
So if we had gotten pregnant, and then the next time she would come back, she would be, let's say she got pregnant at 36, and she has to deliver and rest for a year. By the time she comes back to try the second one, she'll be 38.
Mm.
And it will be unlikely for us to have more kids. So we decided early that we should do IVF. Maybe we can pull some embryos so that we can get pregnant a bit later. And and thankfully for us, that's what happened. So we had our first kid when she was 37. 2 years later, we went back and we got our second one. And now our third one is just delivered. So
Yeah.
so firstly, we married late, like many other couples in Singapore. And we had a bit of forward planning as well,
Mm.
being in the business.
Yes, yes. What were moments where the two of you really had to gel as a team, where you felt like if we get this together, we become stronger as a team, actually, and as a couple going through IVF, because IVF can have lots of ups and downs, right? As we know.
Yeah,
And what
yeah,
helped you to gel together as a good team?
exactly. So initial part before when we were trying for the first few months, we were still okay. But after a while, we really got very, 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 very anxious
Mm.
about the whole thing. And of course, the final result was good. We now have 3 kids.
Mhm.
But in between the, like, the number of eggs, the
Mm.
fertilization, all did it was some of it was a bit disappointing.
Yeah.
So, but we persisted with it. So, I mean the I would say that the experience for the male partner and the female partner is actually very, very different.
Mm.
Usually the female partner has feels all the guilt and has to take all the blame usually, and while the male partner is usually less has doesn't suffer as much. So there's a gap there, and I think having gone through it, I think that's one thing that needs to be bridged.
Yes, yes. And this is such an important observation that you
Yeah,
did, actually. Yes.
yeah,
Thank
yeah.
you.
So
Thank you
for
for
so for
sharing.
the male partner to really understand what the wife is going through and try
Hmm.
and be supportive.
Hmm. So how do you support actually your patients that are going through their fertility journey? What are you paying attention? You mentioned about that you see them sometimes for 5 to 10 minutes, and usually they would behave very well in front of you, and you may sense that there is maybe more going on. Um, but how do you support them to help them to decrease their anxiety?
Yeah, I think the most important is to really try to listen to them, to
Mm,
see what they have to say,
mm.
or try and listen so that they can feel heard and not be rushed through the consultation. I think
Yeah,
that's very, very important because that will help them feel it better and whatever the outcome of their tests and their
yeah.
results. So very funny. I even had patients who, while undergoing IVF, and it was so bad that they didn't even complete the cycle, and after that they got divorced. So it's
Oh,
really, we had patients like that as well. So it's really and IVF can, infertility treatment in general can be a time of really heightened stress. So I think
absolutely.
it's important to have counselors support and counselors to help them tide through this time. Okay, because
Yes.
of course it's just a temporary thing. Usually things will improve later on, as most things, right? Yeah.
Yes, and this is so great that you are mentioning this as well, Dr. Chua, because this is like what we are seeing in counseling as well, that the counselor is usually not medically trained. We understand what the patient is going through and what more or less you as a doctor discuss with them in terms of their treatment. But we really focus more on marital issues, on
Yeah.
strengthening actually the relationship, on building up resilience and decreasing stress and anxiety. These are really our pillars on what we focus in counseling. So I can't wait to share more experience with you and your clinic.
Yeah, I totally agree. It's actually sometimes just a marital issues will come to the fore. In fact, some people may think that, oh, actually we have issues in the marriage, and
Mm.
having a baby will solve that. I think that cannot be further from the truth. Having a baby will only add more issues to what you're currently facing.
Yes. Yes.
So having a counselor either during fertility treatment or other times is very, very important for them to at least reduce some of these or settle some of these issues before having new ones,
Yes.
right? Yeah. Yeah.
Absolutely. You mentioned something very important that I just caught on the male spectrum, you know, when men actually feel quite guilty about putting their wives through an IVF. Is there anything in particular that you find a counselor should actually do or say to men going through IVF?
Oh, I think the main thing, at least from my personal experience, is that you have to really see it from the wife's perspective, because they are the one who is actually doing the jabs, right?
Mm,
Getting the undergoing anesthesia and the surgery and procedures,
yeah.
and their bodies are the one that are getting all the hormones and
Mm,
finally getting pregnant.
mm,
And the hormones is very, very it's a lot of hormone. It's much more than is natural, right? The
mm.
amount of hormones that we give to the female patient. So I suppose the male partner has to see it through uh the perspective of the woman and try and understand that and then support the wife throughout the whole process. Be it doing the injections, sending her
Mm,
to the doctor's office, bringing her home after that, and of course it's important to also have continue the normal life, right? For example, date
yeah.
nights or meals or holidays, all that must continue.
Yes, exactly. That's
Yeah,
what
you
it
should,
usually is as well.
yeah, the fertility treatment cannot be just the main focus of everything else is ignored. Yeah.
Yeah, yeah. And I hear that so often from these patients that they are saying, we are putting our life on hold because we decided to do an IVF. And I just reply to them, exactly now you should actually live your life at fullest because putting your life on hold doesn't help really.
Yeah. So I've got patients who have they have worked so hard to
Yeah.
on their career
Hmm.
whole life until they're in their mid to late 30s, then suddenly realize, oh no, I can't get pregnant. And then suddenly they just want to 180-degree change and they want to take a sabbatical off, which is a good thought as well. Uh, yeah, but I think other than that, they also need to do all the normal things, all their normal activities, so that to make them feel that they are actually uh, not just doing treatment, not
Hmm.
just a patient, but is part of their normal life as well.
Yeah. Absolutely, absolutely. We do have some patients that actually decide to quit their job as well to
Yes.
focus purely on IVF or
Yeah.
on the fertility treatments. And sometimes I can see pros and cons for it
Yeah.
because there is so much plenty of time then to think about it. And then we can really see how mentally and emotionally they get affected by all these worries and thought because it seems that they never stop thinking about it anymore.
Yeah, sometimes you need a routine.
Yeah.
You need to go to bed at 10 and wake up at 6. If not, you may be at 2 a.m. you may be Googling
Yeah.
about infertility or something related to that, and you can't even sleep. Sometimes it's like that. Sometimes it's good to have a routine. At least take your mind off
Yeah,
what's happening now. Concentrate on
absolutely.
something else. Yeah, that may be important as well.
Yes, yes. Um, in your opinion and from your experience, Dr. Chua, what do you find helps these couples really the most when for patient outcome, for good patient outcome?
Yeah, I think medically both partners need to play ball. I mean, both of them actually they do. Whatever they've been doing, for example, smoking or drinking, then they suddenly realize, oh, I can't get pregnant or I can't get my partner pregnant, and they really change their life, which is important. And
Mm,
also, I think having, if they need it, or having counseling, it will also help them be stronger together. So a lot of times the wife is feeling that, oh, I'm in this alone.
mm,
Yeah, I don't have much support.
yeah.
But when the husband is there to support them, then the couple actually is one and they can face the challenges together. And when they are successful, they share the joy together. And that
Mm.
is actually much more meaningful.
Yes,
That yeah,
absolutely.
yeah.
So I'm hearing that you are advocating for men to join their wife to come to all these doctor's appointments to the clinic as well,
Yes, of
and
course.
to the procedures as well, right?
Of course.
Yes.
Yes.
Yeah,
It's
it's
always
really
good to see.
important.
Yeah.
Yeah,
Yeah.
yeah,
And I think the wife usually looks a bit happier when their
yeah,
partner is with
absolutely.
them, right? Yeah.
Are there any myths or misconceptions that you can see around fertility that is being shared and you find like not really proven? There is not really much findings in research neither.
Oh yeah, there are some that I always hear over and over. The one is that whenever after having sex, you have to put your legs up against the wall,
Hmm.
uh, to help the sperm swim inside better, right? So
Yes,
I'm sure you've all heard that one. Yeah.
yes,
Yeah.
yes.
Fortunately, it's not really proven. And whatever you do, some of it will always leak. Some of the semen will always leak out, and that's normal.
Yeah.
Yeah.
Hmm.
Okay, and then there's one that I heard was really hilarious. They said said after doing IVF, you're supposed to eat McDonald's French fries and it
Oh,
will help with implantation. Yeah. I don't know where
really?
they got it from, but it's really hilarious. And the people at McDonald's will really be very happy to hear that.
I think
But
so.
I don't think that is proven. Yeah.
Okay,
Yeah.
okay.
And
Yes.
another common one is that some people would say that you don't ejaculate so much, right? You don't ejaculate too frequently. If not, you won't have enough sperm and use up all. But that cannot be further from the truth.
Hmm.
So number one, it's actually easier to get pregnant the more frequently you have sex. And
Yeah.
number two, the body will actually reflexively produce more sperm to replace the ones that are lost. And the new sperm is actually better, it swims better. It
Yes.
swims better, the DNA is better and everything. Yeah.
Yeah. Yeah. Okay. Okay. I hope that many guys listen now to this right here.
Yeah, I think that's really important.
Yes. Yeah. Absolutely. What are your thoughts around the 2 weeks bed rest after embryo transfer?
Oh, I can see why some people actually want because they feel that sometimes during work, if they go
Mm,
back to work during the 2 weeks,
mm,
they may be more stressed or they had some physical exertion and they think that is why
mm,
um they didn't get pregnant. But actually it's not really proven
mm.
because when people get pregnant naturally, they don't really know and they do their own activities as per usual. Okay, so we do give patients rest after the embryo transfer, but I usually advise my patients not to stay in bed. They should be more active, they should be up and about, nothing too strenuous, but they should be able to do their normal activities like
Yeah.
shopping or going for meals, and everything. Yeah.
Yes, 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 that's exactly what we say as well, because I haven't seen any research study indicating that staying in bed for a full 2 weeks would actually increase your chances of getting pregnant.
Oh,
And
I don't
right,
think you.
you're right, you're saying, yeah, so many women get pregnant naturally, and
Yeah.
they would move around. They would do their fitness schedule, they would go stairs up and down and shopping, and yeah, they still get pregnant.
Yeah, and they still stay pregnant.
Pregnant,
Right, yeah. But of
exactly.
course don't purposely go to the gym or purposely run a long distance or something. Yeah, that's
Yeah,
probably not advisable. Lah.
yeah, yeah. I know that you have been in this area for more than 20 years and delivered probably more than 1,000 babies already. Is there, out of all the touch points that you had with your patients, is there one particular story that stands out that really grew close to your heart, Dr. Chua? Like to
Okay.
share?
Oh, actually, I had a patient that they're the usual, they're in the 40s and they tried for many years before getting pregnant.
Mm.
And then after they delivered, then very soon after, a few months later, that they came back and they are naturally pregnant.
Oh,
I mean, that is not something that is very uncommon. Sometimes all you take is that you need the first baby, and that all the stress goes away. Everything gets much easier. The factory is working and everything, right? So they're pregnant, but they stay alone and they were being a newborn, they were kind of overwhelmed and they were thinking whether they can cope with two. And they even thought about terminating the pregnancy. So I just told them take their time to decide. And I told them that this is don't do any rash decisions, and this is the time that is very difficult. There's an adjustment period, and it can be very exhausting for new parents. But usually it will get better once you're used to it, right? You get the hang of it, it will get better. And eventually they did not. They kept the pregnancy lah, and now they're very happy. They have two kids, completed their
oh,
family. I
yeah.
mean, sometimes just with one, they'll feel that this my child is very lonely, right? And he needs someone to play with. And once you have two, is a good number. Yeah,
Mm.
so that's one of the stories that I always remember.
Oh,
Yeah,
beautiful. Thank you. Thanks for sharing.
not
Yes,
at all.
and isn't that so magical when you see these couples, like what you said, they have like either a distraction or they get pregnant with an IVF baby, and then the second one just comes naturally.
Yeah, so I
Yeah,
I
it's
I I think
amazing.
so. And sometimes it's also um the other thing about getting married later in Singapore is not only your sperm and eggs are of lower quality, sometimes your sex life is also affected
Mm,
because being busier, having more responsibilities at work, at home, sometimes it will just kills your mood. And you end up not having sex as frequently as you should.
yeah,
And when you are trying for a baby, the stress level just goes up tenfold, right? So sometimes they may have only do only one time, or even no none at all during the month, and that's really not conducive. So sometimes if that pressure lifted and they can have sex more naturally and more frequently, and that may be it. They may be able to get pregnant by themselves.
yeah,
Yeah.
yeah, absolutely. I also would see that actually quite often with the embryos, once a couple has enough embryos, and they feel really like this peace of mind, that's when I had quite a few couples who got pregnant naturally after that as
Oh
well.
yeah.
When they wanted to take a break to prepare for embryo transfer, they got pregnant before coming in for embryo
Yeah, of
transfer.
course. I have patients that they decided, okay, I'm going to start IVF, and then the next month they get pregnant, or they have frozen their embryos, and before they transfer, they get pregnant. Yeah, yeah.
Yeah,
Sometimes it's like that. They know that, oh, actually, my sperm and eggs are okay. We can form nice, good quality embryos, and they breathe a sigh of relief,
yeah,
and that's then it happens. Yeah. So
yes.
it's actually very yeah, yeah. Many factors.
There is so
Yeah,
many factors involved.
not just
Yeah.
one factor, right?
And that's why probably it just makes our job so, so interesting, isn't it?
Yeah.
Even
And
after so many years.
yeah, so many things to consider, right? Yeah,
Yes.
not just the medical part.
Yeah, yeah, absolutely. Okay, we're coming closely but surely to an end for today's show. I would like to ask you one last question. Well, actually, two more
Hmm.
questions. One is more for fun, and one is something for our patients out there. The one for fun, I almost don't have the courage to ask you, Dr. Chua, because my question was about like you get a day to yourself. How would you spend that day? But knowing now that you have three young children, I don't even know whether this would be realistic for you.
Yeah, every free time I have, I'm with the kids lah. Yeah,
Yeah.
and once they fall asleep and you're so tired, you just fall asleep straight right next to them. Usually it's like that. Yeah.
Okay. Okay. So you may have to wait a little while until you get that day for yourself. Is that
Yeah,
right?
I think so. Yeah. Yeah.
Okay. So maybe more for the patients. For anyone listening who may be thinking about their own or being on their own fertility journey right now, is there any message that you would like, or a message of encouragement, words of wisdom that you would like to share with them?
Yeah, I think firstly, they must know that they are not alone. Okay, there are a lot of people to help them. We are here. You are there counseling to help them, their friends, their spouse, their family. And there's so many couples and women who also have the same problem. So they're not alone, and they should seek help if and when they need to.
Mhm.
Okay, so I think that is also yeah, something that wasn't so well recognized previously, but now mental health, especially during fertility treatment, is more and more getting recognized. Yeah.
Yeah.
So and number two is definitely not, you sometimes you can't expect to get a positive result the first time you try. Okay, I've got patients who failed their first 3 cycles, only got pregnant on the fourth, fifth, or sixth cycle. And there's sometimes the interim result may not be so good. For example, my own wife didn't have so many eggs to when we first did it. So even though the intermediate results weren't good, we
Mhm.
were lucky to have good quality embryos and managed to have kids, 3 kids. Yeah. And
Yes.
yes. Yeah. And lastly, you have to be don't don't beat yourself up too much, Don't have you have to be kind to yourself, and you have to have time for self-care. You have to do and the usual activities that you're interested in, be it exercise or date night or having dinner with friends. All these should really continue. And it will give you a sense of normalcy that this is not the only thing that is important.
Yes, yes. Oh, thank you. Thank you so, so much, Dr. Chua, for sharing these three wisdoms. It's really, really beautiful to hear how you emphasize on self-care, on mental health support, and how you are really there to listen to your patients. This has been so impressive and so beautiful today. Thank you.
Thank you, and I hope to go to Bali soon.
Yes, yes, we shall have a nice coffee catch up.
Oh yeah.
We get your wife.
Yeah, face to face, yeah. Yes.
Wonderful. Well, thank
Okay.
you so, so much for taking the time today, Dr. Chua, for sharing your experiences and also your knowledge in this very important area and to show how you support your patients.
Yeah, thank you for having me here on this interview. It's very nice talking to you, and it's good that you're there to help counsel and help all the patients who actually have so many problems, suffer so much during the treatment.
Yeah, thank you.
Okay, thank you.
Wow, I don't know about you, but I'm still having goosebumps about this conversation with Dr. Chua. Dr. Chua seems to be one of those doctors that really, really has this empathy and compassion when it comes to fertility and how to support his patients. And I think if you listen to it very carefully, like I was so much in this conversation right now. It really stood out on how he can really feel and sense what's going on with his patients when they face infertility and when he actually supports couples going through IVF. I really like how he emphasizes on emotional and mental well-being during a fertility journey and the importance of actually building a routine around your days and ensuring that there is much activities that actually help to fill your cup each and every day. This is so, so important, and we can't emphasize enough on that. So I feel so grateful and inspired, and I'm walking away flying today, totally flying. So if you want to learn more about Dr. Chua, please head over to Alpha IVF Center Singapore. Their website is in the show notes, as well as here, alphaspecialists.com.sg. And you can even find Dr. Chua on Instagram, Dr. Kahi IVF. You will find him there, and there is so much more he shares on his Instagram. All the information is in the show notes as well as in the links below. Thank you for taking your time today and being here with us. Please take care of yourself. As Dr. Chua said, self-care is really important. Do 3 things that do good to yourself, to your loved ones, to your friends, and to whomever you would like to share it. Thank you, and see you here next week. Bye. Take care. Thank you for joining me on this episode of the Fertility Counselor podcast. Remember, you are not alone on this journey. If you need support or have any questions, reach out to us via email at inquiries@counselingconnects.com. Don't forget to follow us on social media at Fertility Connects. We'd love to hear from you. If you want to learn more about us and the services we offer, head to www.fertilityconnects.com. And if you're looking for support beyond fertility, visit www.counselingconnects.com. Take care, and we'll see you in the next episode.